introduce my team. So for today in this webinar, it's on understanding depression, and it's a pharmacology in action session. So our aim is to teach you and overall for everyone to understand what depression is in simple terms. I'll be your moderator, and I'd like to first introduce all the speakers. We have Haji Ombayo, Olive Njeru, Jordan Mbogwa. We also have Joy Sonia, Alir Bur, and Frida Nyamwea in this session as our speaker. So essentially, I can just give you a small rundown on what this session will be, and the speakers will talk in detail about everything else. So this is just about understanding depression, what depression is in simple terms, its overview, why depression matters, what are the contributors to depression, as well as busting myths and stating the facts about depression, treating options, and support as the last things that will be discussed today. Yes, so thank you very much. Give me a minute, I share the slides that we presented. Yeah. So I'd like to welcome the first speaker, that will be Olive Njeru. Thank you. Olive, you're still muted.
Oh, sorry for that. So good evening, everyone. My name is Olive Njeru, and I'm your first speaker. So I'll take you through the introduction parts. Please go to the next slide. So first we look at lifting the fog on depression. So depression is often described as a fog because it can make a person's thoughts and emotions and daily life feel unclear and overwhelming. And just like a fog, it can make it difficult to see the way forward, and can affect how people view themselves, their future, and the world around them. So unfortunately, depression is a topic often surrounded by silence and misunderstanding. And today we aim to clear the air, providing a safe space to learn about the realities of this condition. Then the aim of this presentation is to move from stigma to support through education, and the presentation combines compassion, evidence-based, and accessible information. And by the end of this presentation, we hope that all of you will have a clear perspective on mental health and a vital as a vital part. Okay, next slide. So first, what is depression? So depression or depressive disorder is a common mental disorder or loss of pleasure or interest in activities for long periods of time. Then depression is different from regular mood changes, and it affects all aspects of relationships with family, and it can also result from lead to problems at school and at work. It is not a character flaw or personal weakness, and it requires understanding, often professional treatment. So it requires understanding, support, and often professional treatment, and it is more than just a feeling. Thank you.
Next speaker.
Okay, so moving on to the next slide. Let's zoom out a bit and look at the global picture. So what we have here is the hard data that is essentially anchoring on our entire discussion. And we see in 2023, the World Health Organization estimated that depression affects roughly 280 million people worldwide. So to break that down, about 5% of all adults experience depression, with it being higher in women than in men. But what really stands out, especially for the majority of us as students, is that nearly 50% of young adults between ages 18 and 24 report experiencing symptoms of anxiety or depression at one point. And to essentially put that into perspective, that is half our demographic. We also have to recognize that depression doesn't impact everyone equally. Significant disparities have been reported based on socio-economic status, racial and ethnic backgrounds, as well as sexual orientation. We also see regional spikes in countries like Greenland, Greece, and yeah. Next slide. Okay, so these numbers lead us to the next part of our discussion. Why depression matters to everyone. Depression, like many disorders, is not a condition that happens in isolation. It tends to create a ripple effect. So starting at the individual level, this would mean a reduced quality of life and real physical health complications. And again, as pharmacy students, that would complicate a treatment plan when you have physical symptoms. The burden of depression can then move to the family level. It causes emotional exhaustion for caregivers as well, and strained communication as family roles suddenly shift. From there, the impact would move to the workplace, seen as absenteeism and decreased productivity, ultimately cascading into our communities, placing massive demands on social services that are already strained. So this is all to say that when you look at it from a broad lens, it becomes incredibly clear why depression isn't a personal diagnosis, but a global health priority. Thank you.
I'll welcome Frida Nyamwea as she's the next speaker.
Hello, everyone. So I'm trying to fix my video. So I'll be taking you through biological contributors to depression. You'll pardon me on my camera. I think it has some issues. So under biological contributors to depression, we're going to look at what really happens to the physical being to bring about depression. So the first one is usually neurotransmitters. These include serotonin, dopamine, and norepinephrine, which are the brain chemicals that help control mood. So in depression, the way these chemicals send signals can be disrupted. Then the brain structure is where there's a place of hippocampus, which handles memory and emotion. So in depressive episodes, this region may not function correctly. Then the other one is cortisol, which is the body main stress hormone. And when it goes out of balance, it can either trigger depression or keep it going. So there are usually different contributors to depression. So the first one is usually psychosocial. Psychosocial, basically, there are two. When one usually have negative thoughts, and when they're prolonged for a long period of time, it can cause depression. Then also when one has low self-esteem, it will also increase susceptibility to depression. Then under social factors, the first one is isolation versus connection. Loneliness usually raises risk, while strong relationship will protect against it. Then socioeconomical stress, money problems and inequality will create ongoing and chronic stress. Then also relationship quality. Conflict, heavy relationship or lack of support can also trigger depression. So one usually presents with different symptoms of behavior. So the first one is usually low mood. They usually feel empty or a heaviness that does not lift even when good things happen. Then there's also irritability and frustration. The other one is feeling of worthlessness, which include intense guilt or self-criticism. And the other one is emotional numbness, where they feel a sense of disconnection from one's own feeling.
Thank you, Frida. Our next speaker will be Haji Ombaya.
Good evening, everyone. So I'll be presenting on the physical and the cognitive symptoms of depression. I hope I'm audible. So, okay, for the physical symptoms, these are the symptoms that are normally visible. And majorly, the first thing that the people around the depressed person will observe. So they include like fatigue or decreased energy. We also have sleep disturbances. It can be maybe insomnia or sleeping too much. Insomnia is whereby like the person has a difficulty in falling asleep, or maybe if they fall asleep, they don't have a continuous like sleep, maybe for maybe 8 hours like the normal human person. Then the normal person, there's also appetite changes. This can be maybe increase in appetite or loss of appetite, which normally ends up affecting the weight. There can also be unexplained aches, as pain, or even digestive issues. Yeah, and there's also slowed movement of speech. Okay, for the cognitive symptoms, these are the ones that deal with the person's thinking. The effects that are associated with how the person is able to think. So the first one is we have difficulty in concentrating or remembering or making decisions. We also have recurrent thoughts of death or suicide, negative or distorted thinking patterns, and also brain fog or mental sluggishness. Okay, for brain fog, I think the first speaker was also presented on it. It's whereby the person is having a problem, like they're not able to think clearly. They're feeling like, okay, it's like they're mentally, like the tiredness, I can say that. Yeah, they can't make decisions correctly. So how is depression diagnosed? So unlike other illnesses, okay, depression and other mental illnesses, they're not diagnosed like we don't do the lab tests for the depression. So for the clinical interview, so the person just discusses their symptoms with the psychiatrist or maybe the expert in that field, and through their discussion about their symptoms, the duration, and the daily impact, then the person, the psychiatrist or the expert is able to determine. And there's normally a standardized tool known as the DSM-5, that is the diagnostic statistical manual, I think. Yeah. So in that manual, it normally gives like for you to like diagnose or maybe decide this person has this kind of symptom. So it like explains that maybe, okay, especially for depression, that person has to experience the symptoms that we've talked about, like for example, the loss of energy, hopelessness, also maybe loss of appetite, and also such symptoms are also are all categorized, and maybe given the duration of time for a person to conclude that this person has depression. Ensuring, okay, for ruling out causes, ensuring symptoms are okay. The expert also has to ensure that they do the definitive diagnosis, whereby they, like, before they conclude that this is depression, the other conditions that can cause a person to present such symptoms like that are somehow associated to depression. So they have to rule out other conditions like thyroid or other conditions. And for the duration, for the symptoms that I've talked about, they have to like be shown for a minimum of about 2 weeks. I think it's 2 weeks, according to the DSM-5. Yeah, so like yeah, like if they experience for less than that period, then it's not depression, or maybe can be something else. But for the expert to conclude that that is depression, it has to be for about 2 weeks.
Thank you very much, Haji. I'll call upon the next speaker, that is Joy Sonia. Joy Sonia. Okay, I think Jason is unable, so I'll help her out. So I'll continue from where my other colleague had stopped. So what is depression and what does it really mean? So depression is it's more than just having a bad day or temporary sadness. It is a complex medical condition that affects a person's thinking, how they feel, and how they handle their daily activities. While everyone experiences low moods, clinical depression is defined by its persistence and its impact on people's ability to function. So one is there's a difference between sadness and depression. Sadness is just a natural human emotion triggered by difficult events, while depression is a persistent state of that may not have a clear external cause. While its duration, the symptoms typically last for at least 2 weeks to be considered as a depressive episode. And for its intensity, it involves a pervasive sense of hopelessness or a loss of interest in activities once were enjoyed. This is called anhedonia. So let's bust some myths and have the real facts. So depression is not just sadness that you can snap out of it. It is this is a myth that is on the left, and this is a fact that depression is a complex medical condition involving chemistry and genetics, and it requires treatment. The next myth is only weak people get depression. That is wrong. Depression affects anyone regardless of their strength, success, or background, and it's not a sign of weakness. The next myth is antidepressants are addictive and change your personality. No, they do not. Antidepressants are non-addictive and they restore chemical balance to the body and the brain. The next presenter will explain what antidepressants are. And then the next myth is that children and teens cannot be depressed, which is wrong. Depression can occur at any stage and diagnosis is available for all life cycles. I'll call upon Alair Bull to take us through the last few slides. Thank you.
Good evening, everybody. My name is Larry Peter Bull Makwach, popularly known as Dr. Abdullahi on all social media platforms. Today, I'll take you through the treatment of depression. And when it comes to the treatment of depression, there is no one side fixed approach for all the treatment. It generally divides into two main parts. One that is to reshaping how we think and act through non-pharmacological treatment, or chemically balancing the brain through pharmacological treatment. Let me begin with non-pharmacological treatment, as you have seen on my screen. Non-pharmacological treatment is more of it's all about making the brain active in non-medical strategies to help the person feel healed or to help the person feel better. And the first approach in which we make a brain or a person to feel healed is through what we call behavioral activation. Depression often causes people to withdraw and lose motivation, which makes them feel even worse. But this therapy breaks that vigorous circle by helping individuals to schedule small, having a positive activities like a brief walk or calling a friend to gradually jumpstart their energy and motivation. So activating your behavior helps to release that a bit of stress and is one fast strategy that will help in treating the depression rather than the medical aspect of it. The second approach that we can treat the depression is the conjunctive behavioral therapy. This is considered as a gold standard of a talk therapy. It focuses on helping person identify the negative, the distorted thought patterns such as I'm not good enough, or actively challenge or replay them with healthier, more realistic way of thinking. Because as we all know, or some of us have experienced depression. Depression gives you some low feelings, some low energy of you start to feel like you cannot do this, you cannot do that. But if you being given a conjunctive therapy, it will help you to gain some confidence in yourself and ability to speak. Another approach that is not medical is interpersonal psychotherapy. Our relationship heavily impact our mental health, and the interpersonal psychotherapy focuses specifically on how we communicate and how we relate to the key people in our life, helping us to resolve conflict, communication, and build a stronger social safety net. The last approach that we can solve the depression is problem-solving therapy. Problem-solving therapy, this highly practical, action-oriented approach. It teaches people how to break down massively overwhelming life circumstances and into a small, manageable, solvable step. A problem-solving therapy played a very great role in how we manage the depression. If you have a therapist close to you, they will guide you, they will take you through, they will give you a possible solution to a possible problem that you're going through. Now I'll take you through the pharmacological or the medical treatment. When depression is moderate to severe, now the physical chemistry of the brain often needs support. And the most common use medications are selective serotonin reuptake inhibitors. This serotonin is a key chemical messenger in the brain that helps to regulate mood, sleep, and emotions. In depressed brain now, or in depressed person, the serotonin is often reabsorbed too quickly. So the selective serotonin reuptake inhibitors like fluoxetine, this help to block that absorption and leaving more serotonin active in the brain pathway to help restore the balance and live up basically a person mood. So that is a fast medical treatment or a pharmacological treatment in which we can treat depression. Next slide. The second part on how we can take care of this condition is self-care. Self-care, the aspect of self-care is not far more than just relaxing. It involves making daily active choices that protect the brain, protect the mental brain, build a physical resilience, and keep us connected to the reality. So first here, the body and mind, maintaining the routine for the body and mind is one important strategy to keep doing activities that you used to enjoy. Depression thrives on isolation and loss of interest. So forcing yourself to engage in all habits, all hobbies, even in a small dose, help to keep our brain connected to a positive stimulant. Another strategy in which we can take care of our brain and body is regular exercise. Physical activities release endorphins, which are natural mood boosters and lower stress hormone. Even in 10-minute walk, 5-minute walk can significantly reduce the anxiety and clears off the brain. Lastly, under the body and mind, it is also important to stick to regular eating and sleeping habit. The brain and the body are deeply connected, and poor sleep and erected nutrition directly impaired mood regulation and make consistent sleep and regular meal foundational to recovery. Next to connection. We should stay connected to friends and family. Isolation is one major symptom of depression, and it also makes the condition worse. So talking freely with the trusted one acts as a vital release of mental pressure, reminding us that we don't have to carry the weight alone. Finally, let's look at the health habits and professional care. Under health habit, it is very important to avoid or cut down on things to do like alcohol and drug related. People often use this substance to self-mediate or numb their pain. As our professor, Dr. Ermias, said last week, the class of drugs such as opioid are being abused so much because of what they actually do, like the morphine that help to reduce pain and all that. So, however, the use of alcohol or drugs actually help, it affects the central nervous system and increasing the drug. So this actually disrupts the brain chemistry further and making the depressive symptom more worse once the temporary effect wear off. Lastly, let's say what we call a guidance from healthcare providers. While self-care is powerful, it doesn't really replace the professional medical care. And knowing when to ask a doctor or therapist for help is a crucial sign of strength. So next slide. The last slide on how we can treat or how we can prevent this common factor in the society today, because a lot of deaths that we are recording or we are hearing lately, most of them, if not all, they are caused by depression. Most people are depressed for one or two things. Probably there are so many things that cause depression. Maybe you've lost loved ones, anything happened to you. So, and if you don't have people who are taking care of you very well, or you live in isolation, you can simply go through that stage. And when you're alone, you start of, how do I go about this life? My entire world has come to an end. What am I living for? And all that. So many people tend to choose suicide as a way of living this world. And it's very important that we, the healthcare workers, take charge on how we can prevent this kind of thing to happen, this kind of death that are happening. And you know, the first message is, you are not alone. When someone is in a dark place, they often feel completely isolated, and as if no one else could possibly understand them. So reminding them of recovery story shows that others have stood in that exact same darkness and successfully found their way, is a very quickest way to heal them. It's a very quickest way to bring their mind back into normal life, giving them hope, telling them stories that so many people have been through this. You're not alone, and give examples of, you know, a few people that you know. With that kind of messages, it helps the depressed patient to at least feel a little bit better. The second message that you can pass to them or you can tell them is share how you feel. Most people, especially men, it's so hard for men to open up. It's very, very, very hard. And when a man opens up, that is literally almost at the last stage of his life. So when you're around this kind of people, you know, you just have to like ask them in a very nice way to share how they feel, and keeping, like, let's say, keeping the suicidal thoughts secret make them feel heavier and more dangerous. So breaking the silence by talking to a trusted family member, friends, it could be fear, allow the loved one to stop in and to step in actually and help keep the person safe. So when you speak to them in this kind of tone and ask them how they feel and everything, when they open up later and you give messages like you are not alone, it will give that relief, and they will not have that, they will not have those suicidal thought again. So next to the third step that we can use to prevent the suicide from happening is what we call the consult the expert. The suicidal ideation is a medical emergency. Just like a severe physical injury, reaching out to help professionals, doctors, or trained crisis counselors ensure the individual get immediate and evidence-based care safety planning. Last to the presentation, join a support group. Being surrounded by a community of peers who are going through similar struggle is incredibly healing. It removes the deep shame, the stigma often associated with the mental illness, showing people that they are understood, valued, and supported on their journey to recovery. This is one of the ways that can actually help, take them, if possible, take them to where, if rehab, if at all, and then where the people with similar problems are staying, and it will make them feel like, oh, I'm not alone. I'm not the one going through this kind of situation. So why do I have to? Why do I have to take my life? Because the suicidal ideation is it's a health or is a medical emergency, and it really need to be taken care of as quick as possible. This has come to the end of our presentation, and depression it is a treatable kind of condition. With the right treatment, active self-care, the professional support, and a strong support system, all this can lead to a recovery. Thanks for listening, and I'm very happy to have presented on this specific topic because we have lost so many souls to this condition, and we are all trying by all means. If there's a way we can go outside there and spread this information, help people, even if you're not being assigned to by your neighbor is struggling with the same problem, it's good always to render advice. You give a free counseling and all that, such that we prevent people from losing their life. As healthcare workers, that's our role. So I'm giving all of you tasks as my classmate. Go outside there, spread the gospel, and the gospel should be, how do we treat people? How do we help people from recovering from this specific condition that has claimed so many lives? Thanks so much for listening. This has brought us to the end of our presentation. And I thank my amazing team members and for the good work that we have done to make this presentation possible today. Thank you so much. Thank you, Professor, and have a good evening.
Thank you very much, Bull. As we have come to the end of our presentation, I'd like you to give us a round of applause to all the speakers that have spoken today, all the 7 of us. Thank you very much. I'd like to open maybe the floor for maybe a question and answer session before we end this meeting, if possible. So if anyone has a question, you can raise your hand. If not, I might have mine. Yes, Joyce Shabene.
Hello, thank you so much for your presentation. It was really informative, and thank you so much once again. So my question is, does depression really heal? And or it's something that if you get it, it will keep coming back and coming back? And when do you know that someone has completely healed and they are stopping the medication? Yeah, then my other question is, I know that there are so many antidepressant drugs, but as a pharmacist, what do you base on to start a patient on a certain type of drugs? Because I know there are SSRIs, there are TCAs, and so many others. So what do you base on to choose a drug for a patient? Thank you so much.
Thank you very much. I'll welcome one of the speakers to answer to Joyce Shabene's question. Perhaps Haji or Ali.
I'll answer that. Joyce, thank you so much for the wonderful question. And if I can remember, the first question was like, does depression really heal, or does it keep coming back? Yes, the depression is a treatable condition, like I said, and many people recover quickly, especially when they receive the right treatment and support. However, for some individuals, depression can be recurring, meaning it may return, especially if there are ongoing risk factors such as the chronic stress, the family history, or stopping the treatment too early. With all these risk factors, the depression might come back. And a person is generally considered to have recovered with the when the symptoms have resolved and are functioning normally in their daily life. And this improvement has been maintained for a quiet period of time. Like I said, one of the risk factors that can make the depression to come back is when things like when you have chronic stress, the family history, or stopping the treatment too early. So regarding the medication part, the patient should stop. No, the patient should never stop antidepressant on their own. The decision to stop the treatment is made by healthcare professional after assessing the patient recovery. In most cases, antidepressants are continued for at least, if I'm to remember last semester, the antidepressants are to continue for at least 6 to 12 months after symptoms improve. This is to reduce the risk of relapse and that travel gradually rather than stop suddenly to stop to avoid or withdrawing symptom and reduce the chance of recurrence. The second question, the second question was like, was it like, how do pharmacists or doctors choose which antidepressant to prescribe? Was that your question, Joyce?
Yes, please.
Okay. The choice of antidepressant depends on so many factors, rather than using the same medication for every patient. Some of the main consideration of factors might include the severity or the type of depression. You know, the various type of depression. So based on all those different types, the choice of drug is made from there. And then also the age of the patient, the overall health, other medical conditions such as heart failure. If the depressed patient has a heart failure also, or like things like liver disease, you know, and then other medication. If the patient is taking, let's say, the TB drugs and the person is depressed, now you need to talk to the patient to avoid a possible drug interaction. So also you also look at you also look at the side effect profile of, in case the side effect profile of the drugs that you're about to give. For example, if the patient has let's say insomnia, and so antidepressant with a sedative effect might be preferred, I think, as well as if they are concerned about the weight gain or the sexual side or the sexual dysfunction effect. And another option might be shoes, not exactly this one, because you don't want to like give drugs that might go and produce this same side effect that the patient is experiencing. So I think this is enough information to answer your question. And if you're not satisfied, you can also let me know. Maybe any of my group members has a say on it.
Okay, thank you very much, Bull. I'll give a brief moment for Michaelina and the next speaker to answer. Michaelina, kindly keep it brief so that we can finish this webinar in record time. Thank you. Michaelina, you have the floor.
Sir, my question is, how do you differentiate between ordinary sadness and clinical depression?
This can be answered by Frida.
Okay, so sadness is usually a normal reaction to maybe a difficult event, and it usually passes after a few days. But when it comes to depression, it's usually persistent and may not have a clear trigger. And it may interfere with daily functioning, such as going to work, school, or maybe even doing normal chores.
Okay, thank you very much to the speakers who have been able to answer the questions. I hope the ones who asked are satisfied. As we come to the end of this informative session and educative session as well, thank you very much for joining us in our pharmacology in action session to do with understanding depression. And as you have seen, from the presentation, it was simple, it was good to, and it was very easy to understand the details that were being presented as well. I'd like to thank Dr. Erinus for giving us this opportunity. I'd also like to thank all the speakers that were able to present as well. Thank you very much. And I'd also like to come and thank everyone who was able to join us in this webinar and participate in one way or another. Thank you very much, and have yourselves a very good evening. You may leave at your own pleasure. Thank you very much. Unless I can